So we talked about how cognitive behavior intervention should be synergistically treated or provided, as treatment for the patient with medication-assisted therapy, or depending on the level of care from the screening process. But we need to understand that cognitive behavior intervention does modify the brain to make better decisions and to control and cope better with the cravings. So some of it includes psychological motivation, therapeutic communities, mindfulness, self-efficacy, contingency management, life skills, peer support groups, nursing-led self-care education groups. All of these interventions are considered cognitive behavior interventions or cognitive behavior therapy, which um, is cognitive behavior therapy is provided more with a professional like a social worker who can provide more details involved with that. But the general concept is to definitely change the decision-making process, the coping skill, active process in preventing opioid use. We continue with directly linking patients upon release to OUD community provider reduces overdose relapse and rates of reincarceration. So the central theme and problem is addressed here with a very consistent theme that when we do link patients to an outside community provider as they release without interruption, without lapses, they will have a significant reduction in the overdose rate, the relapsing rate, and rates of incarceration or reincarceration. The long-term effects for recidivism were inconclusive. The studies were not clear whether or not patients were getting reincarcerated after several years or how long after release from prison they remained in remission after 5 years. So that was interesting to note that there's definitely more studies that will continue.